Morale's low, like, because we just feel like we're asked to do more with less.
She's worked in healthcare for more than a decade and a half. Elizabeth isn't her real name, and we have agreed to protect her identity because of a real fear she could lose her job for speaking out.
I think what people don't understand is
she feels compelled to break her silence because of changes coming to Alberta Health Services. She feels the overhaul will make an already strained system worse.
We have no idea what that means for us. Nobody has told us.
The UCP government is in the process of dismantling the provincial healthcare provider, instead creating 4 health agencies responsible for different areas of care. Their goal is to reduce emergency and surgery wait times and increase access, but Elizabeth says the real issue is a lack of staff and not enough places for sick people to go.
There's no walk-in clinics that are open. There's no urgent care centers that are open in their area. And then acute care is no longer considered acute care. It's just if I'm sick, I'm going to go to the hospital.
She says having to navigate different agencies before and after a hospital stay could create cracks in the system.
Once you silo that, it creates more red tape and it's more difficult to actually have continuity of care.
The province has held public engagement sessions and town halls. A statement from the Minister of Health's office says, in part, Alberta's government is committed to maintaining open lines of communication with Albertans and healthcare professionals, and is establishing new advisory councils with direct lines to the minister to empower local decision-making. But Elizabeth says these decisions are being made by people too far removed from the realities of the front line, and the $85 million set aside for the restructuring could be put to better use.
More of it needs to be funneled into frontline staff and less rebranding, less siloing, because then it just adds more doors we have to open or close for patient care.
Megan Cobb, Global News.